Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Marlin Moyer. He's Associate Vice President of Electronic Health Records and Clinical Systems at Geisinger. Welcome, Marlin.
Wonderful. Thank you for having me this morning, and looking forward to our discussion.
Yeah, excited to be here at AWS reInvent to talk to you about Epic in the cloud, which, not just the cloud, but the public cloud. I think it's a really interesting story that a lot of people are interested in. But before we go there, tell us a little bit about yourself and Geisinger.
Oh, thank you. Been in healthcare, working with Geisinger for about 20 years. Have achieved degrees in healthcare administration, business administration, as well as information technology over the years. Spent a lot of time working both in pre-hospital emergency services before coming into the IT realm of healthcare.
Oh, wow.
Really gives a different perspective working in both that clinical side as well as then on the IT side to bring it all together. So Geisinger's had a lot of great achievements over the last 20 years, and looking forward to talking about some of those with you.
Awesome. So tell me, why did you decide to move Epic to the public cloud on AWS?
So managing the infrastructure for Epic, for any large application, is increasingly costly, increasingly complex. And as we looked at what are our options to move us forward, not just in 5 years, but 10, 20 years, a lot of decisions had to be made about where did we want to move. And we have two very nice data centers that we operate and have operated for many years. But we needed to look to the future. And the future is really being able to leverage new technology, leverage new technology sooner, and continue to advance and grow. And part of that led us to, let's look at a cloud solution. Originally looking not just at Epic, but across our compendium of applications and services that we render. And looked at partners. And as we spoke to several of the large options that were out there, we identified Amazon as our solution, looking at them not only for what they can offer, but the reliability and the ability to continue to grow, and what they were willing to do to work with us to be able to successfully have Epic run in the cloud. We were very early on looking at what are those options. And Epic running in a public cloud we were above that threshold of where we could go there.
You're pushing the envelope.
We were. And so we had to work with them and with Epic to really make that envelope be bigger. And they delivered on that. They continue to deliver on the growth and the opportunities. We, to the best of my knowledge, continue to be the largest single instance of Epic on any public cloud. And we pride ourselves not on that achievement, but to show the art of the possible. And that is really what's out there. It is possible. You challenge yourself, you challenge your vendor partners and your team to go there. So really, we looked at it as not only a way to sustain us, but also to position us for future growth in not only those that we serve, but how we serve them. And it also gives some cost abilities to control those and to plan those. I think those are some of the biggest reasons that we looked at and how we got to that cloud journey.
Yeah, I want to dive into some of those benefits in a minute, but let's talk more about how Epic reacted, because obviously a lot of CIOs were reluctant to go to the cloud. I classically remember a CIO at a conference saying, well, yeah, we're in the cloud, but we don't want to be. And I kind of feel like Epic was that way for a while too, and maybe in the beginning for good reason, they hadn't matured enough or whatnot. But how did Epic react when you decided to move to the public cloud?
They were supportive of us.
Oh, really?
It was. They were very open and transparent with us. They worked with us to understand what are the limitations.
Okay.
They want us to be just as successful in doing this as Amazon wanted us to be successful. And we partnered with Deloitte for an implementation partner. So we weren't the first Epic organization to go. As I said, we were definitely the largest at the time. And they offered us an opportunity to really understand what should we be looking at in terms of the scalability, what we needed. GREFs is very common referred to when you're talking to anybody about Epic. How many global references per second? And could Amazon deliver what we needed? And could they deliver what we were going to need in the next 3 years, as this was a long journey?
Sure.
And so that's a lot of what they offered, not any desire not to have us go that direction, but really to work with us to make sure that we would be successful in going in that direction.
Interesting. So talk to me more about some of the benefits of having Epic on AWS. Have you been able to shut down some of those data centers? Is there a long-term plan towards that? Or speed is important, right? I mean, we hear that all the time. Burnout is a problem. If it takes long to log into Epic, that's a problem. Did you see some benefits there? I mean, what kind of things have you seen?
So a couple of different things. I mean, you hit on a couple of things I want to really talk about because I think those are the reasons to do some of this. So as we moved, we have about 40% of our overall servers, not just Epic, but everything that Geisinger supports is now in the Amazon cloud. And what we looked at was how do we do this and how do we do it right and what do we want to see? And so we went through a lot of rigorous testing to really look at that response time, as you said. We would love to say we're all electronic, but there's still paper everywhere. You have to provide papers to patients to take with them, all of the regulations.
It's only paperless if you scan.
That's right. And so, we've been able to, offload all of our Epic hosts, all of our Epic servers, everything, the entire infrastructure of Epic is in the cloud. And so what we've seen is our implementation plan called for us to move to the cloud as a failover, and then fail back to on-prem for a few months, and then fully convert after we do another region 3 months later. We moved to the cloud in September, and we had so much positive reviews from our end users about the improvement in speed and response times. We made a decision at day number 3 of being in the cloud that we were not moving back.
You don't want that kickback.
And it was nice. Our IT leadership team huddled, our executive teams, and we looked at the data. And in healthcare, you don't often want to make those decisions of let's change the plan at the 11th hour.
Sure.
And in most industries that operate in that way, we're very plan oriented. But it was the right thing to do, and so we gathered a lot of our experts and said, okay, what do we do to stay here? And so at that point, we were still kind of a hybrid, and we said we're staying, continued to see that positive outcome from the users, and we ended up then just doing a DR from cloud to cloud to prove all of that works, very important, and had a lot of success. The other area that we saw the success is our scalability. So one of the things that we saw is nothing is pristine in estimating how many servers do you need, how many users will you see on each server, those types of things. You have a lot of estimates.
Sure.
We saw that as we did this, we went in much higher than what we really needed. We also planned for an upgrade. That we did an upgrade in the cloud that was not planned, but because we decided we were staying, we did it in the cloud. And so we were able to scale up servers, increase the number, our presentation servers and various support servers, and recognize then that the utilization was not high. And we were able to scale those back and right size. And so what we've been able to see is the ability, from a cost savings perspective, is the ability to scale up when you need it and scale back down when you don't. Whereas in the past, those would have been capital expenditures that were sitting in the data center, whether we were using them or not. And if they were turned on, then we were also paying for the power for them, which was, still an expense. So that's probably two of the biggest ones. We did see a lot of speed and response time benefits to our end users, and then also the cost measures for us.
Yeah, that's awesome. And the flexibility, who knows if you're going to acquire 3 more hospitals like most. So
acquire hospitals, we are an institution that has both a health plan, an educational arm, and a big research arm in addition to our provider delivery. So as we're doing a lot of research or we want to do a lot of analytics, we can scale that up to meet that research or that grant need and then scale it back down. Able to really give people what they need, and people being our end users that are then providing the care. So it's great to be able to support that.
Interesting. And what were some of the lessons maybe you learned, that others that are considering Epic in the public cloud, that you could offer them?
So I think one of the things I would have done differently is probably fully flesh out a FinOps program prior to embarking on this,
Okay.
or at least very early on in the stage. And that's important because I think you always want to report out, were we successful? How did we do this? And when you're trying to develop that FinOps of how are we going to operationalize, and also, as we're modernizing and moving forward, but how are we right sizing? And that FinOps program is one thing I think we could have learned to do it earlier. I think we're successful at it now. We're still growing and evolving. We have areas to grow as well. But that's one thing I would have done different. The other is, and what we did, and I would say is a lesson learned that was a very positive one, is we didn't look at what do we have today and how do we just shift and lift, or lift and shift.
Okay.
And we looked at what do we want to have? Where do we want to go? Do we want to isolate the instance more? When you're all in your own data center, firewalling and opportunities are different than when you're going into a public cloud. And it's an opportunity to really look at your whole landscape and say, where do I want to position ourselves from a security perspective?
Gotcha.
From an accounts perspective, separating things out. How do I want to be able to show the cost of different things? Really looking at that and identifying all of your goals as an organization, and then seeing how, whether it's Amazon or it's Epic on Amazon, how do you really make that be successful? And how do you achieve what those goals are? That's probably the biggest thing, is to really identify those first.
Awesome. You talked a little bit about your team's reaction. If it's faster, they got to be happy. But talk to me more about the team's reaction, but also the staff's reaction to Epic and the public cloud. I imagine you had some staff that were used to the in-house infrastructure, data center. What was their reaction? How did you navigate that and the decision to move to the public cloud?
Definitely anxiety. There was anxiety, and there's anxiety because our staff really cares. They've prided themselves on having stable platforms, on ensuring redundancy, on all of those things. We have a great team at Geisinger in IT and in our operations. And I think that anxiety was probably the biggest thing that we needed to just step back and educate, so we could all learn and understand, here's why we have anxiety, here's the areas of concern, and how do we address those. So education was one of the first things that we did do. And everybody from our network analysts and our application analysts getting educated on how to do what they need to do with, the Palo Altos or the EC2 instances, to our executives understanding what is this thing called the cloud. They're very smart people, but there's really a lot more detail as you get into it. What's a region versus availability zone? What does that really mean, and what can it provide to the organization? So I think understanding the education and everything that's out there about it was probably one of the key aspects to really moving forward in getting the team to develop a plan and a strategy that would make us be successful. The other thing that I think, our partners with Deloitte, who had done this before, again, in a smaller scale as far as Epic is concerned, listening and learning from others is always important. So that's one of the reasons I love to talk about it, is to give back and pass it forward.
That's awesome. Well, sometimes we think Epic's life, and sometimes Epic thinks they can be all in one. But of course, you've got other systems. It's interesting you mentioned that 40% of your applications have moved to the public cloud. Talk to me more about that, and what other applications you've moved. Which ones are you looking at? What's your strategy to know, when should we move to public cloud, or when should we keep it offsite, or some other version?
So it's actually 40% of our servers are in the cloud. If we look at applications, that's probably about I think that number is largely higher. But there are some that we just can't move yet. And it's positioning them. It's working with our vendors that support those systems. Not all of them support virtualization, whether that be on-prem or in the cloud. Sure. So our strategy, though, is to migrate as much as possible to the cloud. We continue to look at, for each of those vendors, is it a vendor provided cloud solution, vendor solution as a whole, or is it in our cloud and still virtualized? Our desire, as I said, is to get as much as possible up into that cloud, and that's the direction that we continue to go. So we've migrated our facets, which we use for our health plan, as well as various applications. There's hundreds of applications that support the clinical enterprise, from temperature monitoring systems to a lot of our research-based platforms have moved up there. And that's another interesting one, because that's another aspect of thinking about what your goals are. Research is an area where oftentimes you need de-identified data.
Sure.
So you put that and you can segregate that, it's de-identified, and you can grow and expand that, or move some servers into a downgraded state when they're not in use. And so that's the other thing that I think is beneficial as we look at that.
That's awesome. Well, Marlin, I appreciate you coming over here during AWS reInvent to talk to us, to share about the move to the cloud. I think there's a lot of CIOs, directors of infrastructure that are looking at this. So thanks so much for taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Marlin.
Thank you. I hope you have a wonderful rest of reInvent, and hope everybody is able to benefit from this.